courage, complicity, and compromise, complex roles of professionals in the ghettos and the camps. Let's start with anti-Semitism. Anti-Semitism did not begin with the Nazis, and long before the war, there was anti-Semitism in many countries, of course in Germany. When Hitler came to power, about 11 to about 17% of the doctors were Jewish, when in actual fact of the population, they only comprised about 1% of the population. One of the first initiatives by the Nazi government in April 1933 was to boycott all Jewish businesses, including, of course, Jewish medical doctors' offices. Then they were forbidden from holding a position in public service, which included public health physicians and physicians at universities. Jewish doctors were dismissed from their practices and forbidden to work with German patients. Many had to flee the country. In 1935, very important Nuremberg laws were passed, defining the percentage of Jewish blood, removing citizenship from all Jews, and forbidding the intermarriage between Jews and Aryans. But also in the medical profession in 1935, the Reich Physicians' Ordinance was passed, which was in fact a code of ethics, medical ethics for German physicians. And as part of this ethical code, it was written that it was ethical to remove all the Jewish doctors from the profession. This was a well-accepted ethical, moral value in medicine in Germany. And then finally in 1938, the decree was the Krankenbehandler decree, which is the doctors basically, they are no longer recognized as physicians. They can only be carers of the sick, and in fact revoked all the remaining Jewish doctors' medical licenses. So basically they had their profession removed from them. And then the war commenced on the 1st of September 1939, and the Nazis began their policy of concentrating the Jews in areas designed for them in towns and in cities until they could be transported elsewhere at a later time. These designated areas are what we know, or was known then, as the infamous ghettos. And this is a map of the ghettos in Eastern Europe, with each dot representing one Jewish ghetto. They varied greatly in size, in the duration of their existence, and in the conditions in each ghetto. But the shared characteristic was that the Jewish people were forced to live in isolation from the non-Jewish population. Overall, there were more than about 1,000 ghettos in German-occupied areas, 600 of them being in Poland. Some existed for a few days, some for months, and some for years. Now, these ghettos were also designed to serve as an indirect instrument of destruction, as a means of physically destroying the Jews by denying them the basic necessities of life. Rather, instead of using lethal weapons, they realized that by ghettoizing, putting them in the ghettos, they could actually destroy their lives just as easily. With the implementation of the final solution, which was the plan to murder all the Europeans, beginning in 1941, the Germans, in fact, began to systematically destroy the ghettos. So first they were designed to serve as an indirect instrument of destruction, to use disease, and by denying them food, of course, and water and electricity and other supplies, they were to fall ill and to die from basically from causes that were connected to the ghetto without even using lethal weapons. But then they have the stage where they deport the people to the camps and they destroy the ghettos. Now, the disasters that occurred eventually in these ghettos can be seen as predominantly medical. Dense overpopulation characterized all the ghettos, and life in the ghetto focused on getting enough food to prevent starvation, therefore to avoid the debilitation that made one susceptible to disease. The ghetto inhabitants lived in appalling conditions with limited food, of course, and space and water and heat, electricity, sewerage, and medical and sanitary conditions. The threat of disease and hunger was palpable long before the Nazis' ultimate design, which was to murder the Jews. And the Jewish communities had to struggle to maintain the health services and the public health of the immensely crowded population. But despite the hardships, There were pre-existing medical institutions that had to be run and new ones that were created according to the positions and needs of the ghetto. Medical practice carried all the worries and uncertainties that it does elsewhere, but many were expressed, especially in the ghettos. In the ghetto, effective treatment measures were basically unavailable for otherwise what would be considered treatable disease. And basically all the conditions that were in place that actually contributed to the breakdown of community health and the spread of communicable diseases, the spread of infectious diseases. Now, even though the German attack on these regions actually caused the spreads of the epidemic, the Nazi propaganda blamed the Jews, as you can see here in the poster, for spreading contagious diseases. The poster says they are lice, they cause typhus. German doctors in occupied Poland continued to urge German occupation authorities to create the ghetto, for example, in Warsaw, to actually spread the limit of the disease. And ironically, they actually forced the Jewish self-help organizations and medical organizations in the ghettos to help themselves and to fight these epidemics and these infectious diseases without, of course, providing the conditions to do so effectively. So the German method of controlling these diseases was to use brutal quarantine and disinfection methods, or to set fire to the hospitals with the staff and the patients set inside. But despite these hardships, in many of the ghettos, in most of the ghettos, you can see what we call medical resistance forming by the Jewish inhabitants themselves, by the doctors and the medical healthcare personnel in the ghettos, where they wage an epidemiological war, basically, against all kinds of diseases, especially the infectious. And in many cases, they were even successful. Another factor that had to be taken into consideration was the constant danger, of course, and fear that became an inherent part of the ghetto inhabitants' lives. German arrests constantly harassed Jewish medical activities as they did every other aspect of life. And incredibly, the Jewish doctors organized themselves and their colleagues into different organizations trying to better the health, with establishing self-help organizations and clinics and hospitals. Some of the hospitals were not inside the ghettos to begin with. Some had to be formed and basically created from other buildings and with equipment in the ghettos. They tried their utmost to fight epidemics. They even formed in the Warsaw ghetto a medical school, a clandestine medical school. And they performed hunger research despite themselves being hungry themselves, the researchers. There was so much hunger around them that they even managed in the Warsaw ghetto to perform hunger research. So we can look at these activities of the medical personnel in the ghettos as basically medical resistance. Now, the extreme conditions forced them actually to overcome incredible ethical dilemmas at the same time. These were recounted in diaries and testimonies of the people who did survive. Here we have a photograph of the hunger study and a photograph from a book and a photograph of an actual medical student studying in the Warsaw Ghetto underground medical school. As I said, ethical dilemmas were part of their daily work. They had to summon moral courage and moral agency and were faced with a lot of moral distress, and in many ways were very resilient. I would like to just read the words of one of the doctors who did work. It's a very young woman. She went throughout the whole stage of the Warsaw Ghetto, from the beginning to the end, where she writes, for 45 years later in her memoirs, for 45 years after the war, I was a doctor. I really believe that one is a doctor in order to save life anywhere and at any time. For 45 years, I have never departed from this view, but somewhere underneath I thought that I had no right to carry out my profession. After all, one does not start one's work as a doctor by leading people, not to life, but to death. And I've lived with this knowledge to this day, and it does not help me that I know that it was all in order to save people's lives, that it was all necessary. But along the way, something was not as it should have been. Maybe it was too heavy a burden for the rest of my life. She's talking about her work in the Warsaw Ghetto as a very young doctor. Between 1941 and 1944, Nazi German authorities deported millions of Jews from Germany and occupied territories to the concentration camps and the extermination camps. Nearly 3 million Jews were murdered in these camps. Of course, the largest or the most infamous, the famous one was Auschwitz. And there, in these camps, the SS doctors were formally responsible for the health of the camp prisoners, but in fact, they renounced all their medical obligations towards the prisoners, and they maintained the actual facade of medical treatment. And for the first couple of years at the camps, there was no medical or very little medical treatment for the prisoners. There was almost no medical care for them. But when the war commenced and they needed labor for their factories, they allowed basically some of the prisoner doctors to start using their professions and trying to help their fellow prisoners in the camps. This decision to actually allow the prison doctors to work as doctors did actually not improve anything in the infirmaries, but rather the prisoner doctors were permitted to try to administer some form of care. Often all they had was their words, but in some cases the level of treatment did improve. In some cases they were provided with some way of helping their fellow prisoners. Basically, what they tried to do was restore health so that people could return to work. If you could work, you could live in a camp. If you couldn't work, then you were sent basically to your death. But efforts made by the prisoner doctors to protect as many seriously ill and emaciated prisoners as possible were systematically frustrated by the continuing process of the SS doctors of selecting patients for the death. So that basically we had this, they were trying to save people who were actually sentenced to death. And once again, the prisoner doctors often hid or discharged patients in advance of imminent selections, taking advantage of the oversights of the SS doctors who never examined these people, of course, themselves. Prisoner doctors would falsify medical records, hide patients, anything to try and provide for them a chance of survival. Prisoner doctors were sometimes better off, sometimes slightly better chance of survival, just they were less likely to suffer from violence. But despite this, they were in dangers, of course, all the time, and faced countless dilemmas in trying to do the little that they could to save their fellow prisoners. Sometimes they even succeeded. But in some cases, they had to collaborate, cooperate, comply with the demands of the cruel Nazi doctors, especially for those who found themselves working in close proximity with where the Nazi experiments were being carried out. This often left little room for choice, and these situations, of course, led to possible ethical dilemma. But ultimately, minimizing the harm was what the prisoner physicians tried their best to do. Many of the doctors survived because as medical professionals, they had qualifications that could be used in the ghettos and the camps, and because they were willing or able to put them to use there. They were aware of the system that had overridden the normal ethical values and had forced its victims to collaborate. The juxtaposition of the Nazis' use of medicine to inflict pain and suffering on innocent victims with the Jewish attempts, in the absence of even the most basic tools in medicine, to alleviate suffering and preserve life, demonstrates the diametrically opposed purposes to which medical skills could be put. Doctors, as doctors caring for their patients, found a reason for their survival, found a reason to fight for their survival. The course of action that they chose was mostly the one that they deemed best to help their fellow inmates. I would like, as a final quote, to quote Elie Wiesel, who is the Nobel laureate, of course, the well-known novelist, who he himself was a survivor of the camps. And he wrote in the New England Journal of Medicine in 2005, commemorating 50 years at the end of the war. Elie Wiesel himself had experience with medicine and doctors in the camps. And he writes, "Yet inside the concentration camps, among the prisoners, medicine remained a noble profession. More or less everywhere, doctors, without instruments or medications, tried desperately to relieve the suffering and misfortune of their fellow prisoners, sometimes at the price of their own health or their own lives. I knew several such doctors. For them, each human being represented not an abstract idea, but a universe with its secrets, its treasures, its sources of anguish, and its poor possibilities for victory, however fleeting, over death and its disciples. In an inhumane universe, they, the Jewish doctors, the prisoner doctors, had remained humane. Thank you.